This question says, when assisting with a surgical intervention, such as sebaceous cyst removal, which of the following is the primary responsibility of the medical assistant? So this is the part of the question that we will be focusing on. What is the primary responsibility of you as the medical assistant? Everything up here is just other information that they're giving in the question, maybe as a distraction, maybe just to paint a picture in your head of what it is, the scene that you're in, but just to focus on the end part. And that's something that you should notice whenever you see any sort of long question, just so you don't get too overwhelmed, to focus on what is this question asking you. So let's take a look at the choices. The first option, A, says performing the surgical procedure. And that's something we know we can eliminate right away. Performing the surgical procedure is a very specific responsibility of the surgeon themselves. Not even other healthcare workers you'll be working with will be doing that role, such as RNs, probably not even any other sort of provider, just the surgeon themselves. So that's definitely not the role of the medical assistant. So we eliminated that. Option B says administering anesthesia to the patient. This is also another very specific task that would be given to someone with lots of training, such as an anesthesiologist, and would not be the responsibility of you as a medical assistant. So we can eliminate that as well. Option C says assisting the procedure by handing instruments and maintaining a sterile field. And yeah, that's something you could do as a medical assistant. You could assist with the procedure by handing the tools that are needed, other responsibilities that you as a medical assistant will be trained to do and that you're qualified to do. And something like handing over instruments, helping to maintain the sterile field, that's something that you could do. And since this question is asking something that you can be doing, and it's not a not question, that means that we can go with option C. Let's take a look at option D, though, as well, just to be sure. Option D says interpreting the pathology report post-procedure. And no, this is definitely something that's very specific to the provider. They will be the ones interpreting the results. The surgeon will be interpreting the results. That's not within the scope of practice of the medical assistant. So we can eliminate option D as well. And that leaves us with what we were thinking, choice C, assisting the provider by handing instruments and maintaining a sterile field.